Head into the papers now in Nigeria, see what the headlines are this morning. I have with me in the studio house analyst Obaniyi Akinwale. Good morning. Nice to see you.
Morning, same here.
Great. Yeah. Right. Let's start from the Blueprint newspaper. Blueprint says lockdown extension may spark unrest. NLC warns and calls for expansion of social register to flag off affordable face masks for Nigerians soon. And pensioners want palliatives and endure for now. Lagos Assembly begs Nigerians. And COVID-19, Rufai tests negative, orders use of face masks. And that is part of what the trends are right now. That's from the Blueprint. All right, Daily Trust is the next paper we're looking at as push for 110 billion naira for discos intensifies. No template to reach poor Nigerians with electricity. And free power, not possible. Impact will be bleak. Experts are saying this. An absence of consumer fund, huge gap. All right, that's Daily Trust. Daily Times is the next paper now. COVID-19 is still the focal point here. Federal government bans interstate movement of patients. That's Daily Times. Leadership newspaper says coronavirus is real, spreading like wildfire. Federal government warns Nigerians. Links rising cases to increased testing and community transmission, and has some other multiple riders there. That's Leadership newspaper. News Direct is the next we're seeing now. COVID-19 is the focus here. Governors agree on 14 days national lockdown. And cases hit 504 in Lagos, FCT 119, Kano 73. Federal government, 12 states release 3,375 inmates over social distancing. And then after 3 weeks, Rufai recovers from COVID-19, and Sanwo-Olu commissions 80-bed at Etiosa Isolation Center. That's all you'll see on the front page of the News Direct. All right, Obaniyi, the analysts are saying that it is likely that there will be extension of the lockdown in states. And in fact, with more states recording cases of COVID-19, there might even be a national emergency in that regard. We also got reports that state governors are also planning for a 2-week lockdown. In all of this, NLC, from the headline we saw on the Blueprint, NLC is saying there could be some level of unrest here and there.
There is no doubt about it that at the moment there is greater unrest in the land. I could tell you vividly in my own community, for the past 1 week, we have turned to night guards. So we have to wake up because those boys were always walking around the street with guns and with cutlasses. And I'm sure this is obtainable in almost every part of Lagos. The police is overwhelmed, there is no doubt about it, because when you call them, you discover that they are somewhere else and they will not be able to come to your aid. We all know that. But I'm amazed that the only thing that NLC will clamor for is that there will be unrest when in Senate climb, labor unions have seen the way they want to assist the associations. And some associations like NHS has created ingenuity in such a way to ensure the government is not overwhelmed. I think Association of Textile and Garment Workers, a member of NLC, I remember that the current chairman of APC used to be the general secretary of Textile and Garment, Textile and what have you Union. And if you see what we're having now, they are now Ankara bling nose mask. I think the NLC will have make better effort in ensuring that they call their members to create this in order to create palliative for people, rather than just crying wolf when we all know what the problem is. But you ask ourselves, what's the alternative if government refuses to lock down? The alternative is that before now we are testing in 100, in 50s, we're getting 4, 10, 20. And you recall by the time they started testing in thousands, discovered that the numbers started having double digits in 40s and 50s, 91 yesterday, 117 2 days ago. And this is to tell you that the testing capacity is still below 3,000 a day. And sometimes they wait for results as much as 48 hours to get the result. So you asked me when we start doing maybe tests of 5,000 a day, possibly we have a spiral effect on that. And we will not deceive ourselves. We're already spreading that disease from community to community. The case of a woman that died in Ekiti was a nurse from Lagos that went to labor in Ekiti with the virus. She had the virus from Lagos to Ekiti. That's transmission across 3 borders.
Yeah,
a lot of people have entered the commercial transport with the woman. Again, he infected the NMA chairman in Ado Ekiti. So we already started it. So government has no choice. There are choices we have in our hands. The choice number one is that for us to, and if you look at the fatality rate, it's almost about 0.2%, because when you have about 30 deaths, when you have about 800 and something infected, you see that the rate of discharge is about 197 or thereabout. Discharge to death is almost at par now. So if we're not careful, looking at how the system is done, we are clustered in such a way, is that extended family or as a clan or as a community will be beginning to spread the across. There is no doubt that people are already overstretched. There is no road you get to in Lagos that I don't see those boys on the street asking you for money, blocking you, create a lot of tension and what have you. But the question is this: do we ask government to open the doors and we begin to spread this disease and increase the number of fatality, knowing fully well that we don't even have the statistics of number of people that are diabetic, high blood pressure, and underlying ailment, knowing fully well that there are not enough. In Lagos, for example, now you have 504 cases and you know the number of beds available. So if this case continues to spiral, are we not going to have the case of people who are going to be treating themselves at home? And if that happens, look at the effect it's going to have on the entire community. So I will appeal to government that there could be better things, better methods could be employed in terms of creative palliative for the people. But for me as a person, I would rather ensure that Nigerians are safer bearing this, because somebody said the hunger virus kills faster than coronavirus.
We heard those.
Exactly.
In fact, there are several videos now where people are saying that hunger is even worse than COVID-19. Well, it depends on their opinion and interpretation. But where we are right now, like you said, certainly the lockdown is biting hard on so many, in fact, most people. But it is necessary to stay safe.
Absolutely.
So how challenging is it for government to try to talk to people to understand in this space where it is difficult to say, people, you must remain at home and you must come out, as the case may be. You stay home, you're hungry, you come out, you have COVID-19.
I think one of the things I think I've always advocated is that if federal government, as our census data of 2006, we know the number of households in Nigeria. You recall that Lagos State created an agency that deals with the counting of houses and people that are doing the land use charge and what have you. So this gives us an idea of number of buildings or facilities you have in Lagos, either as industries or home. With these statistics, we may not be able to reach everybody 100%. But if we go have statistics of the number of houses in Lagos, the land use charge, federal government house, the census of 2006, know the number of houses, plus or minus 20%, and we begin to make this palliative available for everybody. Either you have 5,000 in your account or you don't have 5,000 in your account. Once this gets there, it's going to reduce the tension. Sincerely yours, people are hungry. I will tell you, people, even you that you have cash on you, you discover that in less than a few weeks, you have exhausted everything you have. So you have to be leading from hand to mouth. So government needs to change the tactics of distribution. And again, the unequalness way of distribution, because I watched a video whereby people were being given 20,000 in some part of the country, while some people are being given 5,000 in another part of the country. That has to reduce. And again, one other thing that I think government needs to do now, because this is an eye-opener for all of us, the government, is that social security numbers, national identification numbers that people have, let us put it to use. This will be an incentive for those people that have registered as national ID card or voter's card or driver license, so that people could have a feel of government. But like you know, an angry man is an angry man. And if you continue to lock people up without making provision for what they will eat, how they will eat, how they will survive, sincerely yours, we are just looking for anarchy.
Well, what do you think is the bigger challenge here? The point there is, from the videos we have gotten and from what people are saying, is that the palliatives from government, whether state or federal government, is not reaching the people the way it is supposed to be at all. The point there is, if you're spreading this thing and the determinant of who should get what, who qualifies, what is the criteria for somebody to get this and get that, that statistics like you were mentioning, some of the social statistics used earlier. Now, when it comes to population, or when it comes to even primary health care, the immunization and all of that, you see those nurses and those health workers get to every home. They mark every house. Absolutely. They get to every nook and cranny of this country. So when it comes to knowing households, even for election purposes, delineation of election constituency and wards and all of that. They know they can break all of these. What is the challenge of getting food and palliatives to every household, really?
So one of the challenges, the challenge we've always had in this country is the issue of data. We don't have data that is, for example, you recall that there were times when people will use the back of walnut to do thumbprint. Some people will use animal oil to do thumbprint and what have you. But overall, when they were telling us that certain percentage of Nigeria are below poverty line, all of us will say, oh, they don't like us, statistics are nowhere. But it's obvious now that during this lockdown of just a month, we have seen that almost 80% of Nigeria are living below poverty line. And again, we have seen that almost 99%, if you permit me, or 90% of Nigeria are small-scale industry, are an informal sector of the economy. So with that, we will realize that until government begin to either put their hands more into the small-scale businesses or ensure that they re-strategize or re-energize the small business or informal sector, problem like this will continue to come. And again, with a government that doesn't have data, we'll find ourselves where we are. There is insecurity in the land. There is no doubt about it.
Okay. Obaniyi Akinwale, thank you so much for your time on the program. Thank you.
My pleasure.
Right. To the papers now, see what the headlines are in Nigeria. And have with me in-house analyst Obaniyi Akinwale. Obaniyi, good morning.
Good morning.
Thank you very much.
Pleasure.
Good. Let's start from the Blueprint. Blueprint newspaper is where we start from, and it's talking about the lockdown. Extension may spark unrest. NLC warns here on the front page of the Blueprint. It calls for expansion of social register and to flag off affordable face masks for Nigerians soon. And the pensioners want palliatives. And endure for now. Lagos Assembly begs Nigerians. And the COVID-19, Rufai tests negative, orders use of face masks. That's what you see on the Blueprint. Daily Trust is next now. Daily Trust says that as push for 110 billion naira for discos intensifies, no template to reach poor Nigerians with electricity. Free power not possible. Impact will be bleak. Experts are saying this. Absence of consumer fund is huge. Huge gap, okay? That's what you see on the front page of the Daily Trust, and I'm sure Nii would like to talk about this when we open discussions shortly. Now let's go to Daily Times. Daily Times is focusing on COVID-19. Federal government bans interstate movement of patients. That's the Daily Times. Leadership newspaper, on the other hand, says coronavirus is real, spreading like fire. Federal government warns Nigerians. And it has multiple writers there as well. From Leadership newspaper, let's go to News Direct, which is the last we're looking at right now. COVID-19 is the focus. Governors agree on 14-day national lockdown. And cases hit 504 in Lagos, FCT 19 rather, and Kano is 73. Federal government, 12 states release 3,375 inmates over social distancing. And after 3 weeks, Rufai recovers from COVID-19. Sanwo-Olu commissions 80-bed at Etiusa Isolation Center. Okay, all these stories on the front page of the News Direct. Okay, Nii, let me the controversy on the issue of free electricity. In fact, Nigerians were jubilating at first when the House of Rep talked about the likelihood or the possibility of discussing with government to ensure that they give Nigerians 2 months of free electricity. Experts at that time were saying, well, instead of even free electricity, if you're discussing the issue of slashing the cost of electricity by half or something, it would be better. Because the companies, the electricity companies themselves are not, most of them are struggling. In fact, they've asked for bailout several times, which government has done, and so on. What do you make here? The headline here says no attempt to reach poor Nigerians with electricity, and free power is not possible.
Let me first say that our National Assembly is what we term in this balance, what we call Sakamanje.
Why is that?
It's scammer. You know, like I've mentioned it severally here.
But you have a representative from your
That's
place.
why I said our. You know, I said our. They are called Sakamanje. They are scammers. It took National Assembly less than 3 months to pass the 7.5 VAT, COT, and tax increment. It took them lesser time to review the budget and get it signed by the president. But it will take National Assembly consultation and appeal to federal government to give moratorium or to buy off power from the power distribution companies. But it didn't take the same National Assembly months to appropriate money to buy latest 2020 model Camry for a member of House of Rep that have been there for almost 12 years that are using SUVs. I don't think if the responsibility of a rep is to represent our interest and to be the voices for the people they are representing, you don't need to ask National Assembly. There is an appropriation act that allows you to say, this is the period of need. If the presidency can sign a quarantine act or presidential order, National Assembly can also, as a bill to the presidency, says people are suffering. Let's say, for example, the telecos in this country have said 10 free SMS every day. The telecos in this country have said if you are paying 10,000 for 10 gig before, now start paying 50 gig. Do they legislate to do that? If the National Assembly deem it fit that they want to reduce the burden of Nigeria, they know how much the discos are paying to the TCN to get power. They know how much the TCN is paying to the GENCOs in terms of to what power they are taking from the GENCOs. They know how much the GENCOs are putting in place to buy gas, to pay their staff, in order for them to sustain the GENCO business. So federal government has the statistics of the entire chain. After all, we have National Electoral Commission. If you have all that, you have the statistics, you have the indices. If we are releasing 25 billion for COVID, 1 trillion, we are taking the sovereign national wealth, how much is cost of electricity in Nigeria a month? Ask yourself, a couple of months ago, the TCM man came to us and said, Benin Republic, Nigeria Republic, and Ghana are owing us in terms of electricity that they are sending, that we are giving them. But in Nigeria, we are Nigeria, we don't have. And during this tough period, we are paying as high as 38 naira, 4 kobo per unit. Some are paying 26, some are paying 18. A serious government, a one that is not Sakam and J, will not go to press and want to grab headline, other than we are seen to be hacked. And acting means the National Assembly to pass it as let them say it's even a subsidy measure to Nigerians and say, for the month of May, June, July, looking at what people have passed through, federal government is going to bond the cost of these expenses. It is not too much to give to a country where people are bleeding. So they should stop all this Akama and J or airline grabbing thing that they are doing on papers and do what is needful. People are suffering. People are crying. You lock people at home, there is no work, there is no money, there is no food. Even electricity is not even constant, yet government is not burning anything for the people.
Exactly. That aspect of the epileptic power supply, I wonder when it comes to free electricity, how Nigerians are even going to feel it, because a lot of people complain of not having light for days and even weeks running.
Let me just say,
yes,
the sector that are still producing, if you read, the highest cost of production in this country is power. So if countries that are still producing essential services, you reduce their power. What it means eventually is that you have reduced the cost of production for those that are still producing now. Then again, if I'm aware that what I'm using this one government are burn it out, it's a sort of relief. Because the question now is that my light is going to go off in the next few days, and I don't have money to recharge it, and I don't have money to buy food, and my government is telling me that I should stay indoor. An hungry man is an angry man. So government needs to do more. The idea of people that have 5,000 in their account is too small, is too big to give money, it is not true. Okay. I can 5,000 in my account and it's your money. You can have me to say money in my account. And 5,000, if you convert it to dollar, is a very bad money. It's less than $18. So which means government is saying anybody that have about $18 or $20 in their account, they don't need to be subsidized by the government. This is very, very bad. And the government needs to act now.
And something has to be done now.
And the Sakama and J reps and the Sakama and J senators needs to do what is needful rather than grabbing the headline of the newspaper.
Obaniyi Akinwale, thank you very much for your time.
My pleasure.
Thank you.
Yeah.
Right.